Good morning. This is Frank Barone at Evolv Medical Aesthetics, and today we're quite excited to talk about what I feel is a real game-changing technology in hair restoration for both men and women, and that is the NeoGraft system. The reason for that is this system is able to transplant individual hair follicles, one or two at a time, without leaving a scar. The hair is taken from the back of the head where that hair typically will not fall out and placed in areas for men and women in the front, frontal scalp, crown, temporal area, even eyebrows, with the natural restoration, natural look, and no visible scars. And today our patient is Steve, who has so kindly agreed to talk a little bit about it. He's 63 years old and actually had a previous strip graft technique where they take an entire strip, which is common, from the back of the head, which leaves a noticeable scar and doesn't give us natural look. So, Steve, what do you think about your procedure today? Are you excited about it?
Oh yeah, very excited and very comfortable too, because the nurses, everybody in the office has done a really great job of explaining what's going to happen, how it's going to take place, and of course, the outcomes and all of that. So yeah, completely comfortable and very confident in how it's all going to go.
With your previous technique, did you notice the scar in the back of your head where they took the grafts?
Yeah, you can. You can feel it a little bit. You can notice it, and no matter how good a job they do of suturing it or stitching it back together, it's there. Mm-hmm. But yeah, and I think this is a different approach to it, and yeah, leaves a lot less after effect, and yet you still get the good outcome. So yeah.
So we'll be focusing for Steve. You can put your head down a little bit on the crown area here, as well as where he's had previous grafts, to try to restore a natural hairline and fill in areas where there's no active hair follicles. Then he'll go on a topical program to retain the hair and prevent any falling out. We're also excited about having Carmen and Christine visiting Toledo. The two of them have nearly 40 years of experience with hair transplantation and these techniques. And that's another game changer, because if we train somebody, it'll take many years, obviously, to have that kind of experience. So with NeoGraft, we actually have these professionals come to Toledo where they can use their experience and their vast knowledge base to assist with the procedure and ultimately improve outcomes. So that's another change, I think, that's going to really be effective for men and women with hair restoration and treating hair loss. So this is done in the office under local anesthesia with a little oral sedation. And we'll get back to you with Steve's progress, and we'll get started. Thanks very much.
Great. Yeah, thank you.
NeoGraft professionals here have finished the grafts on Steve. And if you can get a close-up, you can kind of see the new hairline here, which will duplicate for his age, a natural kind of shape to the hairline. And you can see the little grafts that rise up just above the skin, which is done on purpose, so when they settle, they'll be even with the skin. There won't be any visible scar. The donor site was the entire back of the head, and he had actually 1,700 individual hair grafts. So were you comfortable during the procedure, Steve?
Yeah, absolutely. And in fact, it was so comfortable and so relaxing that I'm pretty sure for the last hour or so I was actually asleep, which was good. That's how smooth it went, and how I think efficiently it was done. And yeah, and I woke up at about the time they were done and said, "Oh, we're done." They go, "Yeah, you've been quiet for the last half an hour, 45 minutes, so it's good."
You've been a great patient.
Yeah.
So we had some oral medication and then some local blocks that was awake for the procedure. So we're going to put a dressing on him now, and he'll be back in the office in a few days to take that off. And eventually, it'll take a few months to start seeing the actual hair growth here. But one of the other great things about NeoGraft is the average take rate is over 95%. So over 95% of the transplanted hair follicles statistically will grow, which is a very high efficiency, and the lack of any visible scarring. So we'll be back in touch when we have some post-procedure results for you. Thanks for your attention. Hi, it's Frank Barone at Evolv again, and we're here with Steve, our patient, at 8 days out from NeoGraft hair transplant procedure. Actually, Steve had over 1,700 hair transplants. He had a previous procedure, the traditional strip graft method years ago, which left a band on the back of his head, but these are the result of the previous graft. So we had a larger area to do, and the hair was harvested individually from the back of the head. Again, this is hair that will not be susceptible to receding or falling out because it's not going to be affected by the normal male pattern loss. I think the interesting thing is that these hairs are harvested individually from this back area and put in individually to establish a natural hairline without a scar at the hairline recipient site or at the donor site. And you'll be able to see he has a scar here from his previous strip graft method, which is one of the drawbacks of that method, besides it not as natural a look. And he also had PRP to help improve the take of the grafts. So Steve's been kind enough today to come in to visit with us and tell us a little bit, Steve. So we're out 8 days now. How's it been going? How was your recovery period? How are you feeling?
Feeling very well. The procedure was pretty much seamless. We came in, started in the morning, was home in the afternoon. Post-op, no issues at all. Just a little bit of finding the right way to rest at night because you have to sit sleeping up for a little while.
How was the pain level? Did you have pain?
Not existent. Very, very minimal pain, much less than I thought I might have, and addressed that very simply. The other creams and the other topical things and the other medications are involved take care of everything. So really, post-op has been a non-issue at all, which is a really good thing because you always worry a little bit about what recovery is going to be like. But in this case, no problem at all.
So it's important to remember that we like to stress it's not just about the procedure, it's about what you do before and after. And
right.
One of the other big advantages with NeoGraft and the success and natural look as well as retention of the hair is the use of their Hairmedica skin topical system,
right.
which is a series of research-proven botanicals that we use on the donor sites after surgery to improve the healing, to reduce any itching,
right.
and to, most importantly, retain the grafts in addition to prevent loss of the other hairs that you might have there.
Right.
How have the products been? Did they seem to help with itching?
Yeah, exactly. The products were very good. Yeah, I had no issues with itching at all. I think your tendency naturally is to want to touch what's up there. Of course, you're not supposed to. But each of the products worked perfectly fine. And I think, in fact, I went back to the office the next day and went into work.
Really?
Was being really careful. Now, I wore kind of a protective little hairnet because at first I thought people would say, "Wow, what's going on there?" But what's interesting is everybody said, we kind of like the shorter look, so it's actually worked out kind of well. I thought they might think, well, that's a little different, but they've been happy with it, and I have been too. But in terms of affecting anything after the operation, nothing at all. You just have to follow the procedures and follow the rules and the applications and that sort of thing. And it's not that big a problem. It's not a problem really at all.
So if we look, he's only 8 days out, but if you look closely, you'll see now these are over 1,700 individual transplants, and you can see the little buds of hair. Some of those will come out, some won't, and then the new hair will grow from below. So within a couple of months, he should have quite a normal hairline here with pretty good hair density. Again, the PRP will help, as will the topical program that we put them on after. We have a specific therapy program to improve the growth of the transplants as well as retain the pre-existing hairs. If we look on the back of the head where the donor sites were, you really can't see where the hair, these were almost 2,000 grafts, you can't see where they were harvested. This is grown back in. You can see the scar from his previous strip procedure, which is why we don't prefer, one of the reasons we don't prefer to do it that way. But he'll have growth here that will cover the area and really won't show the change in density whatsoever. So that's another big advantage of the NeoGraft system is the donor site. This was done in the office under local anesthesia with topicals. So anyways, we're looking forward to seeing some pretty fantastic results out of you, and we're glad it was a nice experience.
Yes, it was. And in fact, I looked at it a day or two later and went, that looks fine, because it's a different look at first, but I was very happy with the fact that within a day or two, everything pretty much was back to normal, and I went about doing what I normally do. You have to be a little careful about exercising. They caution you about that because you don't want to disturb things. But in terms of doing everything else you do in your life, no impact at all. You could go about your regular business with no problems.